Now we're going to go ahead and demonstrate the removal of the wound vac. It's very important that you go ahead and turn the system off. As you can see here, you can go ahead and disconnect. There are some clamps. Go ahead and clamp it off. And then the first thing that we're going to do is, depending on the patient, you want to see if the patient has experienced any challenges with removal of the vac. We can use a syringe. So what you would do is a saline removal of the wound vac. So again, these are going to be for your patients who really have challenges with the removal and complain of pain. What you're going to want to do is pull your clamp all the way down to the very bottom. It's going to expose the tubing. As you can see, I cut it. Keep a short amount of tubing there to make it as easy as possible for us to instill saline into the system itself. So let's keep this as a closed system. And as you can see, the tubing and your syringe, it fits nicely right in there. So you're gonna go ahead and instill saline into this dressing prior to removing. So let's pretend that we instilled all of our saline here. Everyone asks how much saline is appropriate. Truly, you will see the dressing itself lift up. And then once that's kind of filled with just enough saline, go ahead and clamp it off. Let it sit and soak for just a couple minutes. And again, what's gonna happen here, it's gonna allow the saline to get to the base of this wound and allow that granufoam to lift up from the new tissue that we've been working so hard to grow over the last couple days. So it's very important, again, we do this. Patients who experience pain, they will be way happier with the removal of this dressing. So the next step I like to recommend is popping off this tubing. What this will allow us to do is to see how big that hole is. So it's important for us to check the work of the previous clinician to make sure they were cutting this hole big enough. We are seeing sometimes when we go to remove these dressings that the tissue may be quite macerated around on the peri-wound skin, and usually that's an indicator that the two sensors didn't have good access to black foam. The hole may have been too small and it was being occluded by tegaderm. That usually will allow for all that exudate to pull in, and it usually will just sit here right in the dressing instead of being pushed through to the tubing to the canister. So keep that in mind. Take a peek, see how big that hole is. If the hole is too small, you may want to have a conversation with the home health nurse who is doing those dressing changes. Now, when we go to remove this, it's very important we keep our knuckles down, and you're gonna roll it back, just as if you were kind of kneading bread, right? Another thing, you can use an adhesive remover. This will allow the adhesive on our tegaderm to lift up prior to pulling it back. So that is just a couple techniques that we recommend you use. When you are pulling this back, take your time. Again, if you did the saline technique removal, this is gonna be like lifting a wet Band-Aid. So it should be pretty easy and manageable to pull off. Something else we wanna do that's very important when removing these dressings here, you also wanna make sure that you're assessing the wound and make sure that every aspect of that dressing comes out. Very important that white foam is never left behind. So make sure those come out, as well as any non-adherent contact layer that may have been put in the wound bed. As you can see, we have exposed bone. The provider before may have decided to use a non-adherent. Go ahead and take a peek, make sure nothing else is in that wound bed at removal. So I'm gonna go ahead and just continue on with the removal here. And now you should be all set and good to go.